Okay, hello. So I'm gonna give you guys an example of your cervical traction and kind of the process that you need to take when you're doing your cervical traction. By now you should have already did your P's and C's, so roll out the big ones. Do you have any shunts in your skull?
No.
Any plates?
No.
Have you had any fractures in your cervical spine?
No.
Do you know if you have vertigo?
I do not.
Okay, sounds good. So once you've seen your P's and C's with your patient, you always have to do your vertebral artery test first to make sure that they are a candidate for traction, since the point of cervical traction is to elongate, to get fluid into the disc. You're gonna be separation between the vertebrae, and sometimes that also goes hand in hand on top of the arteries in the neck, so you don't want to have too much any backflow. So, vertebral artery test, if you remember, is you're gonna have them in your hands. Okay, I'm going to go ahead and put your head back below neutral. We're gonna hold there for about 30 seconds. I'm gonna do it in 3 different positions, and you just let me know if you feel dizzy, nauseous, or if you have any nystagmus.
Okay.
Okay, so we're down. So just checking for nystagmus. I probably have to cover that, but everyone's not till now. Okay. Keep your eyes on me. Nice. I'll slowly bring you back up. Any issues with that?
No.
Okay, so patient has a negative vertebral artery or your occlusion test, so now I can continue with my cervical traction. You also have to give a buy-in, right? So they're gonna be in this position for a little while. Did it work?
Yeah.
Okay, sweet.
Okay. Thank you.
Go ahead and lift your legs up and down. Alright. I'm going to do a suboccipital release. I'm gonna let them feel what it's gonna be like when I go ahead and pull. So you're trying to get underneath that occipital ridge. Okay. I use my, kind of like my 2 fingers here, and I kind of make a diamond shape, or you can use the 3 fingers and then kind of pull at the same time. So whatever works best for you. So I'm gonna find my ridge. Yeah, and I don't do soft, I do hard. Good. Take a deep breath in. As they relax, they tend to melt, so that way you actually can get onto the ridge a lot better. For cervical traction, oh, it's sensitive on this right side.
Mm-hmm.
Yes, okay, okay. All right, we'll take a couple release breaths. So deep breath in. And relax, good. Just allow the patient to kind of get used to you. The other side here, deep breath. So cervical traction, you want to have a good posture because you're going to be holding the head. I'm going to lower the table just a little bit so I'm not just laying my arms on the table. Separate. Take a deep breath in, and all I'm going to do is kind of pull. So you use your retractors on your scapulas and pull back, or you can go ahead and pull with the table. How does this feel?
Like stretching my head.
Yeah, sounds great. Perfect. And then you're probably gonna do it intermittently, meaning that you're gonna have to re-centralize your hands. Some people will go ahead and use towels, including if the patient is a little nervous. Go ahead and lift up your head again. You can use a towel to kind of give you that traction, and that way you can pull a little bit more. Better?
Better.
Yeah. So everybody has their preference, so you just let the patient tell you what they prefer. I'm gonna do this, if I can hold it for about 15 to 30 seconds, in just a straight pull, meaning in line with the body. After that, you kind of resituate, and you're gonna trial your levels, meaning you're gonna trial your angles, because as your head starts to go into more flexion, it's going to hit more down the vertebra. So a straight pull here would be 0 degrees, and that would be working on the occiput C1, C2 region. And as I slowly start to increase into flexion, it goes down the spine, and once we get into terminal flexion right there, that's gonna be hitting at C7, T1. Okay? So, I'm gonna do 3 test pulls in 3 different positions, and then your patient will tell you what feels better. So this is test pull number 2. This is test pull number 3. Out of the 3, which one did you prefer?
Number 2.
Number 2. So we're probably gonna hit maybe around C3, C4, C4, C5. And so then I'll do my manual traction in this position. Good. So that's your clearance to see if your patient would be a good candidate to do mechanical traction. Some patients just prefer manual traction, so you'll just have to bite the bullet and just learn to work with them and build that as part of your manual treatment. Otherwise, we do have cervical traction units. Should probably have all this. Okay, patient, now that you're situated for a little bit, roll over to your side. Go ahead and sit up for a little second. Good. Sit up. Right there. Good. Dizzy?
No.
No? Okay. Feet should always be on the floor, including if you ever leave a patient. So, if they can't get their feet on the floor, then you put a stool underneath their feet. Maybe this bed is dead. So let's charge the batteries when we're done with them, everyone. Okay, put your feet right there. Just hold yourself down. Good. As I set up my cervical traction unit. Alright, cervical traction. If you're gonna go and use cervical traction eventually down the line, hopefully you'll try to get them a cervical traction unit for their own home. So you have to give them patient education on how to use the machine. Explain it, set them up in it, and then set up the levels. On the side here, you have 3 different levels. Depending on your test pulls that you did for your patient, you will set them up in that way. So that's why you do the 3 test pulls. Okay? So if we're looking at it on the table, that's gonna be around your C6, C7, T1 range. Drop it down to your C3, C4, C5. And then straight flat pull would be your occiput C1, C2. Okay? So your patient, well, my patient said she felt good at the 2nd level, so that's where I'm gonna go. Patient, do you have any fear of claustrophobia?
No.
Okay. So we're gonna put a tissue across their forehead. Because oil is a thing. Not a lot of people like to have oily foreheads. So what we're going to do is you're gonna open the pummels as wide as they can. You're gonna have your patient lie on their side and roll into the device. So go ahead and scoot down just a little. Okay. Lie onto your right shoulder, onto your right side, and then roll into the machine. Much better. Much more better than having them lie in supine and having them pick up their head and as you try to slide this machine in. It's a lot more comforting. You're going to tighten the pummels. They should be resting at your mastoid processes. And once they feel like it's snug, go ahead and tell me when.
It's snug.
Then you just go one more just to make sure it's tight. You're gonna put the tissue over their head. The strap is going to keep their head secured in that same place so it doesn't move. It's not. It's slightly tight, sorry. You okay?
Yeah, but
Okay. So they shouldn't be able to move a lot because you want them to be relaxed, right? You are we're going to again set them up in a position of comfort. Go ahead and lift up your feet and down. And depending on what you are trying to achieve. So, static holds are gonna be good for discs. Discs sit a lot more deeper than facet joints or muscle lengths. Usually it should be, everybody does intermittent at the clinic, but if you wanted to do a straight pull, no more than 8 minutes, that would allow the disc to fully refill, and then that would be good enough for a treatment. But patients like to go have on and off time, which is basically them pumping and then releasing and then pumping. So it depends on what you're doing. So disc, no more than 8 minutes, straight static pull. If you're doing facet joint or for an impingement or trying to centralize pain from radicular symptoms, as well as, what else? That's about it. That's gonna be more of what you're using for the intermittent. So if a patient wants something a lot deeper structures, so your disc, since that sits in there, you can go ahead and hold it as a full static, meaning I'm going to go ahead and pump. An average head for any human is, for women, it's between 8 to 10 pounds. For men, it's between 10 to 13 pounds. We're going to go ahead and start them off at a third of their body weight, or if I know that I want it to be deeper, I know that they're gonna wanna be able to feel the pull, so I can go ahead and have them let me know when it's comfortable. So I'm gonna pump your neck up there, Madi, and you just let me know when when it gets comfortable. You have 3 settings. You have hold, pump in the middle, and then release. So the hold is obviously gonna be what you put it when you are done pumping. You're gonna change it to pump, so that way you can see as the pistons move up, the cervical traction is going to move and elongate the spine.
That's good.
That's comfortable? So if I wanted to release, it would just drop the pistons out, right? It fills with air. So we're gonna go back up. She had felt it around about 12 pounds of pressure. Right about there?
Yeah.
Okay. I'm gonna change it to hold. And the same thing like our hot and cold packs. I am going to give my patient a bell just in case I am not present. And then I'm gonna put them on a timer. So straight disc, 8 minutes. And you can go ahead and set the timer. If you do leave the room, make sure you give them the bell, you let them know where the timer is. You also give them the piston. So that way if they feel for whatever reason like they're getting dizzy, nauseous, or they feel like they're getting claustrophobic, you can also just tell them, okay, Madi, look to me at the right. You see where it says release?
Yeah.
All you're gonna do is just twist that to release and it'll let go, right? Okay. And then make sure if I'm not here, just ding that bell so somebody can come in.
Okay.
So those are your time frames. If we were doing an intermittent setting, I would go ahead and have them hold maybe about a minute, depending on how long I want the rest time to go, and then go from there. If I wanted to do a muscle stretch, I could actually go to a low load, which means that they're not gonna be able to feel the pull. Alright. So I'm gonna just pump it to about 10. Do you feel that? Yeah, a little bit. Is it a lot or?
No, it's like a little.
Okay, so then I'm just gonna go ahead and hold that. And I would set this on a low load, so lower pressure, not as much poundage of pump, and then I could leave her here for about 12 to 15 minutes. True elongation would be no more than 20 to 25 minutes, okay? Because as you can see, it's gonna, as she breathes, as she relaxes, the muscle's eventually gonna lessen, and it's gonna start to stretch naturally since she's starting to relax. But you still have like a subtle pull on it. It's not like a deep pull where you feel like, okay, I can crank it up and I can take more. No, you don't want that for something that's a long duration with a low load, okay? If you want something with a high load, that's usually something they can feel themselves. They can feel the difference, or they can feel it pulling, so then they can feel what that would be like. So that's your low load for your long duration of time. If we wanted to do this for intermittent, again for your facet, your impingement, what else would I say? What other fun field things? Your DJD, and your DDD, so degenerative joint disease, degenerative disc disease, I can go for that high load. So, Marty, I want you to go ahead and pump until you feel like it's comfortable.
Okay.
And then you're gonna change it to hold, and then we're gonna hold there for about a minute, and then we'll relax for a minute, and then we're gonna do that off and on. Okay, so change it to hold. Nice, and again, start the timer, 1 minute on, and then 1 minute off. That would be sufficient to start with, as long as you're in the room. Obviously, if it's going to go ahead and you're gonna leave, then you can go ahead and do 2 minutes on and then 1 minute off. Most of the time, most people will go 5 minutes on, come back, and then let them rest for a minute, and then leave again for another 5. So we'll wait until the timer goes off, and when the timer goes off, we'll go ahead and release, and I'll set it again for a minute, and then we'll do it again. So make sure you're giving them consistent time frames, including if you're ever going to leave the room, which in the real world, in outpatient, you leave the room quite a bit. I'm trying to think if there's anything else I want to mention. I can't check my phone because it's like, go ahead and release that for me. Okay, and then we'll go ahead and start it. No, just
No?
let it break, and then
Okay.
once the timer goes off again.
Okay.
Oh, darn. Okay, you guys can watch Marty for a bit while I go and leave my patient alone.
Damn it.
Did you pump it again, Marty?
I'm going to right now. You got your paper? Or
Got
whatever.
my tablet, it's even better. Alright, so things I will ask about is your setup, how to get there, how to position them correctly. You always wanna start for your first pull, including if a patient has never been in traction before, and that's another question you wanna ask them, is to do just 10 pounds, so that way they can kinda get a baseline of what 10 pounds feels like. If after that they wanna increase the rate of the pump to something more, then that's fine. But always start at 10. For the cervical spine, you should never exceed 30 pounds of pressure in the pump. That would just be way too much. You're just adding way too much fluid at that point. And after a certain period of time, 8 minutes according to research, the disc is not gonna overfill any more than that. So not just stick with 8 minutes? Treatment times for disc herniations is between 5 to 8 minutes. And then for an acute inflammation or acute flames or acute issues, and then for 15 to 30 minutes for any type of muscle lengthening, joint disease, joint facet relief. Let's see. The cervical spine should be 7 to 10 pounds. Go ahead and release. Of the body weight, and then they're on and again, off again. So as long as you're with the patient, you can do that 1-to-1 ratio. It should most likely be 3-to-1 ratio for intermittent, or you can go up to 5-to-1. So 3 minutes on, 1 minute off, or 5 minutes on and 1 minute off. Anything else? Muscle spasms, disc protrusions, elongation, acute conditions, no more than 11 to 15 pounds, 20 to 30 pounds for joint distraction, so for your facet relief. Okay, I think that's it for cervical. Make sure you always do your manual cervical and test runs at the levels prior to you putting them in the machine, so that way you know what levels to treat at. And just make sure you tell me approximately what level you think it is. So remember, straight pull is gonna be occiput 1, 2. Anything out with a slight incline as we start to go up, it's gonna be from 3 to 5, and then when you hit more so at that end range of their flexion, C7, C6, and maybe even T1. Okay. All right, that's all I got. Questions? How you doing, patient?
I'm good.
All right, so thank you very much. Okay, sorry, some things I forgot. So before you let them out, make sure you release the pistons and you take off the strap. You give them a minute before you move them, because that way they can get situated. The blood is now rushing back down and it's no longer going up into the head, so they might get a little bit dizzy. Once you give them a minute of sitting, you're gonna have them get sit up the same way they got in. So you're going to go ahead and roll to your right side. Okay, and then you're gonna sit up and always guard your patient, and if they can't reach the ground, make sure you put a stool under them. Okay, thank you.